Hi, everyone. I'm Christa Studzinski. I have the honor of moderating today's panel. And before I kick it off, I just want to welcome all of the panelists for taking the time out to be with us today, to thank CABHI for giving us the opportunity to bring this discussion forward to the community, and also to the attendees for signing in and listening today. The Ontario Brain Institute is a government-funded, not-for-profit that focuses on advancing brain health solutions, evidence-based brain health solutions. And so we do this in a number of different ways, but really by facilitating the research, the commercialization, and embedding that into the care that is happening across Ontario. So we're going to be talking a little bit about the future for seniors and their healthcare. And basically, the way that we age and interact with the healthcare system is rapidly changing, and increasingly seniors are living and aging in the homes of their choice. And so as a community, we need to co-design with seniors and other partners in the care continuum to test out alternative models for accessing care in order to meet seniors where they are. And so today's panel gives us the opportunity to highlight one of these projects. Before we invite our keynote to come and talk a little bit about the end user perspective, I'd like to invite Jennifer from RetiSpec to give a quick overview of the project that we've been working on together.
A little over a year ago, the Davos Alzheimer Collaborative put out a global call to action to identify feasible Alzheimer's screening programs, and they actually received an overwhelming response of more than 75 applications from 24 countries. And they then awarded 12 novel projects with grants. And I think this is just a really easy way to see why there's a demand for innovation. For our particular project, adults who are 65 years of age and older and have a memory complaint can undergo our community-based screening process through two entry points. So one entry point is through the Alzheimer's Society of Toronto, where they can receive cognitive assessments. And the other entry point is through their annual optometry visit, where they have the option to receive the RetiSpec eye scan to predict biologic signatures of Alzheimer's. The test results are then shared with the participant's primary care provider. They have a follow-up appointment to discuss the results. And this was really important to us because this maintains the continuity of care. The project also facilitates access to a nurse practitioner, who is Amelia, that we have with us today. And we've done this to ensure that those people who didn't have an available primary care provider did still have an opportunity to speak about their results. Finally, through the project, we will evaluate risks, benefits, facilitators, and barriers to these community-based settings as a means of sustainable health system access points for cognitive and biomarker assessments for Alzheimer's disease.
A participant who was part of this study actually talking about their experience because of ethics approvals, and because the study is currently ongoing, we weren't able to unblind RetiSpec to some of the participant participation. So we have Shmuel from the Alzheimer's Society of Toronto, who is really going to speak on behalf of the participants and share a little bit of the experiences that he's encountered in working with them. Shmuel?
Yes, so I've been involved with this study for the past few months. And I'm doing the cognitive assessments with the participants who want to undergo the assessment. And I really find that it's helpful to offer this screening in the community. We're doing our best to make it as easy and convenient for the participants, even offering it at local seniors community centers or community housing buildings. So we are doing our best to get this out there and increase the participation in the study.
And Shmuel, maybe you could talk a little bit about some of the feedback that you're getting from the participants and why they decided to engage in this study.
Sure. So many participants want to make sure that they're planning for their future, and they want to understand the differences between aging and some normal memory loss due to aging versus memory, what cognitive changes that happen with cognitive impairment or dementia. So many come in to do that, to get the screening. And they've been all the participants have expressed appreciation that they can come and do the assessment in a very convenient way and without usually longer wait times when it's in a clinical setting to get that test done. We're able to send it straight to their family physician or to Amelia for them to follow up and get the results and either a diagnosis if appropriate or to sometimes referral to further testing.
And Shmuel, would you say that the participants are motivated to participate in this study because of the really long wait times that they're facing in order to have their cognitive status assessed either in primary care or by being referred to a tertiary clinic?
I think that's definitely one factor, is offering this in a more readily available setting, in a community setting where they don't have to face those wait times. Sometimes it's just also easier for them to come into a less clinical environment in our office or the different locations where we're offering it. A lot of people are concerned about confidentiality, so they feel like if they do it through the study and we're just sharing it with their doctor, they feel more comfortable with that.
And I don't know, this question wasn't really one that we rehearsed, but would you say that the care practitioners, so the general practitioners who do receive the feedback from the Alzheimer's Society of Toronto are receptive to this feedback and that they welcome the opportunity to be able to have someone with more specialized training be able to assess the cognitive function?
I think that that's one of the challenges we're working with. But generally, the family doctors or the physicians are open to receiving this cognitive assessment, and they're happy that we're doing this in the community and getting the screening. And I think that as we continue to promote the study and offer this, hopefully in a long term as well, once the study is over, we'll build that relationship with the physicians as well, and they could continue. They'll build that trust with our assessments, receiving that, and being able to provide referrals or care to their patients. And
so you've had a fairly positive feedback from the clinicians who've been engaged so far in this project. So Shmuel, could you maybe share one of the participant stories that you've encountered that has really sort of stayed with you through this project without revealing any identifiable information?
Yeah, so we had a participant come in with her daughter to participate in the study and undergo the cognitive assessment, and the participant was really experiencing some short-term memory loss, and her daughter was really struggling with how to provide care in this situation. And by connecting with this study, we were able to do the cognitive assessment, have that follow-up with the doctor, and they really the daughter just expressed her appreciation for us just making that so available for them. And in addition, the follow-up where we're able to connect her with resources with the Alzheimer's Society and other resources in the community as well.
Thank you for sharing that story. And I feel like this is a really good time to introduce our third panelist today, Amelia, who is a nurse practitioner at the Trauma Memory Program. So Amelia, maybe you could do a quick intro and also just really reflect a little bit on some of the information that Shmuel just shared with us about how this is transformative, how this project is transformative.
Sure. Thank you, Christa. Yeah, as you mentioned, my name is Amelia Hansen. I'm a nurse practitioner. My background has been in many different settings. I've worked in hospital settings, outpatient, in home care, in long-term care, and now I find myself at the Toronto Memory Program, where I see patients typically there for diagnosis and treatment of Alzheimer's disease and other dementias. And now through our partnership with this Davos Alzheimer's Collaborative RetiSpec study, supporting this research study to help give the participants an opportunity to have their results shared with someone if they don't have a family physician who they either don't have a family physician at all or don't have a physician who's available or able to kind of follow up on the screenings that the social workers are doing in the community. As we're all well aware, in Canada, there's a huge gap in care at many levels, at all levels probably. I think there's something like 6 million Canadians that don't have a family care doctor, many of whom have been trying to get doctors and are really struggling. And then once they have doctors, once they have family doctors, their wait times to get in to see them are long. Their wait times to see specialists are long. Their wait times to get tests are very long. So it can be potentially years before somebody is able to be fully assessed if they have memory concerns. So this study is looking at the feasibility of an alternate means of assessment, which I think is really fantastic. Whatever we can do to help ease the burden on our primary care system, on our the wait times for our memory specialists, I think would be really fantastic. We have seen that it's feasible for social workers in the community to meet people where they are, to do assessments in their community centers that they're attending anyway, to go to their housing authorities or their buildings and really lower the barrier to access screenings for memory concerns. And then, it's been great to be able to be a resource for people who don't have that family care follow-up opportunity, to be able to come from my background my background, I guess, in treating and diagnosing dementia, to help people to know where they are, what they should do, what we can do together, and how they can, proceed forward, to give people a little more confidence.
Absolutely, Amelia. I mean, I think I have ties to rural Ontario, and certainly models of care like we're testing out in this project really start to make things a little bit more accessible and equitable across the province, which is fantastic. So pivoting slightly, I mean, we've talked a lot about the cognitive assessments and how those are happening in the community setting. Jennifer, do you want to maybe comment a little bit on how you see neurotech helping to transform the future of healthcare? RetiSpec being a really great example.
Yeah, absolutely. So Amelia said a little bit about this already, but we know that the current pathway in the healthcare diagnosis of Alzheimer's is inadequate. The wait times are long, and perhaps where you live can impact that as well. We have high rates of even misdiagnosis for people living with dementia. And ultimately, we have patients and families without timely access to care and services that they need. So we know that the current approach to detection for treatment in Alzheimer's is leaving people behind, and we can do much better. I think progress is happening. We have significant innovation happening in the Alzheimer's field, both in therapeutics. Specifically, the FDA last year has approved 2 medications that are defined to be disease modifying. We also have innovations in diagnostics. So there's tools such as the one that RetiSpec designed, which is a retinal imaging test to detect the biological signs of Alzheimer's disease. There's also work done by Winterlight in creating a speech-based monitoring for cognitive impairment. But ultimately, neurotech such as the RetiSpec eye test can offer new access points to care for patients concerned about their memory. And in our study that we've been talking about, that's supported by the Davos Alzheimer Collaborative, we've partnered with community-based entry points. So as we've said, the Alzheimer's Society of Toronto is facilitating cognitive assessments. We're also partnering with local optometry clinics to facilitate retinal scans for Alzheimer's disease. And we know that both the cognitive status as well as having pathological information are important components of an accurate diagnosis.
Absolutely, and it's a really exciting time for neurotech companies to be to have an opportunity to really innovate within the healthcare system. And so we feel extremely privileged that we get to partner with you on this project, and also work with other neurotech companies across Canada who are looking at different models of where we might be able to facilitate accessing cognitive screening or mental health screening. So you mentioned the Winterlight Project, and in fact, we're partnering them up with a digital human to actually see if we can administer these tests in the home so that we can track or the seniors are empowered to monitor their mental health and their cognitive health right in the home as well. So it's really exciting times to see how far neurotechnologies have come, and hope to see some of these things deployed in the community very soon. So maybe we could just pivot a little bit, and I'd love to ask each of our panelists, what really motivated you to participate in this initiative? So, this again is sort of not your standard pathway for accessing a diagnosis of dementia. And so what as an individual or as your organization really made you want to participate in this study? Sorry, maybe we could start with Amelia.
Sure. Yeah, that's a great question. So I came on with the Toronto Memory Program specifically, or in part specifically to support this study. I'm very passionate about helping people to live and age well and gracefully, and part of that is understanding what understanding their diagnoses, understanding what they have, what they can do. And I think this is a really great opportunity to expand just people's knowledge of their own health.
And empowering people to take control of their brain health. Absolutely. Absolutely. Shmuel, did you want to maybe weigh in a little bit on what prompted you to participate in the study?
Sure. Yeah. So I think the Alzheimer's Society of Toronto realizes that as our population is aging, there will be a lot more people who will be experiencing cognitive impairment and or dementia. And it's so important to make this more accessible, the screening, and especially the early screening through cognitive assessment, and also through tools like the RetiSpec scan, for make that more accessible, more available to people. And I was very excited to be a part of this research and feasibility study to see how that can play out and how we could roll that in the community in the future.
And did you join the Alzheimer's Society of Toronto for this particular project?
No, in fact, I was a social worker working counseling caregivers before this, and when they announced that they're looking for social workers to be part of this research, I was immediately interested because I thought it was a really exciting opportunity.
It's certainly not a traditional role that the patient advocacy groups have played in terms of the care pathway, and so it's fantastic that you were able to step in and see the opportunity. Jennifer, do you want to maybe weigh in a little bit about what motivated you and RetiSpec team to participate in this study? And maybe you could also comment on behalf of the optometrist clinic who unfortunately were unable to attend.
Sure. I'll speak about RetiSpec first. So at RetiSpec, our mission is to enable widespread early and accurate detection of neurodegenerative disease markers through accessible, affordable, and scalable retinal imaging. So to accomplish this, we really feel strongly in the benefits of working with the optometrists and other eye care professionals. I think this project in specific allowed us to test out our vision on wide-scale adoption in the eye care setting, but importantly, it also allowed us to ensure that patients in our screening program actually have someone to follow them through the continuum of care. And this is really important to us because we know that detection is the first step, but that we need to work together so that if somebody is identified through our screening program, that they continue to get the care that they need and they are able to do so in a timely manner. So I think ultimately this project is a really great example of how we can use community-based resources to enable widespread screening for for Alzheimer's disease. In speaking a little bit from the optometry setting, and I speak just about what we've heard from our partners, they are very excited, and it's also been a very good learning opportunity to see what is working well. And I think it also works to have very engaged partners. So the site there has done a really great job in also speaking to all of their patients. So although they may not enroll in this study, they are asking them and introducing brain health at that in that setting, which is, as we know, non-traditional, but we're trying to kind of forge a new pathway. So I think it's been successful from that perspective. But I mean, you're also creating just more engaged people. So from the optometry perspective, they obviously just bring a different view to it, and helping us learn about what's important to their patients and what they can offer to all of this. So I think it's just been all very useful.
Thanks, Jennifer. And just kind of to expand on that, we've got, just to recap, we've got 2 funding agencies. We've got a nonprofit, the Alzheimer's Society of Toronto. We've got the Toronto Memory Program, and we've got RetiSpec, all partners on this project. And so maybe you could kick us off, Jennifer, and tell us a little bit about some of the barriers that you had to overcome in order to get this really transformative project off the ground.
Yeah, so I think the thing that I'd like to speak about is something that we considered very early on in the project, which is training. So one aspect is that because we're doing our project in the research setting, there is some extra work around making sure that each one of our partners was compliant with research standards. So for those familiar with the research setting, there are very important certifications that we undergo for good clinical practice and ethics. And lucky for us, the partners that we work with have already gone through some level of that type of education. So it wasn't very hard to get us up to the necessary standard. It didn't take a lot of effort. But perhaps one of the biggest insights that we learned early on was the importance of making sure that optometrists and their clinical staff are comfortable talking about brain health to their patients. So we know already that optometrists regularly identify signs of neurological conditions such as brain tumors. And so we know that they're comfortable talking to their patients about these types of concerns and making appropriate referrals. But at the same time, we know that Alzheimer's can be a scary word for people to hear. So making sure that the conversations are happening in a very healthy and welcoming way was an important first step. So what we opted to do was we had the neurologist leading our project, Dr. Sharon Cohen from the Toronto Memory Program. She held a training session for the optometry team to help familiarize them with Alzheimer's and ensure that they were prepared to have these kinds of conversations and with their patients, and also to ensure that those conversations were well received.
Thanks, Jennifer. And I think that's a really good segue over to Amelia and to talk a little bit about what some of the key learnings and some of the key challenges that you guys faced in terms of launching this project.
Sure. So honestly, the participants came to me pretty far along in their trajectory here. By the time they would have seen me at the Toronto Memory Program, they've already had their initial screening. They've already seen Shmuel or one of the other social workers to do that. They've done their consenting. They may have had their eye scan, their retinal scan. When I've been, the participants that I've seen, which were maybe close to a quarter of them, I'd say, maybe a quarter to a fifth of the patients wound up coming my way rather than to their family doctors. The biggest barriers that I found were, excuse me, I think many people have concerns, they'll do their cognitive testing, but then really understanding what that means. Is a normal test? Does that mean that's normal for you? Is an abnormal test? Like, what do we need to do next? So just helping to get people on board with a plan can be a challenge. And I saw many people, the reason why they decided to screen was because they were meeting so many barriers to get screened through traditional methods. So they might have brought up memory concerns to their doctor over the past few years, and the doctor was, said it was fine. The person was totally independent in function. There's no obvious or glaring deficit, but they had real concerns that deserve to be evaluated further. So this was a great way to lower that barrier for them.
And Amelia, would you say, without giving any too many specifics, would you say that in many cases these concerns were well-founded?
Oh, absolutely. Yeah, I think even if we don't go on to diagnose Alzheimer's disease, a concern is well-founded. It's not based on nothing, right? Even if the concern of memory is based on anxiety or depression or sleep apnea or vitamin deficiency or thyroid issues, those are all issues that can be treated and they should be addressed. So whether or not somebody has a neurodegenerative process, their concerns are well-founded.
And it's about, providing compassionate care that allows you to really kind of get at the source of what that problem may be and make sure that we can improve those outcomes, right?
Yeah, absolutely. I mean, the people who bring up their concerns, they want them to be acknowledged too, right? Mm-hmm. Oftentimes they're pushed aside because they're complicated, but they shouldn't be. In our healthcare system, we should acknowledge, we should assess, and we should treat if we can.
Absolutely. And maybe just to pivot slightly, in terms of the education that Dr. Cohen had to provide to the optometry clinic, is this something that the Toronto Memory Program does very often in terms of not only with optometry clinics, but perhaps even with primary care? Or is this something that was really kind of required a generation of new sorts of training materials and those sorts of tools?
So I can't speak to the specific training that Dr. Cohen shared with the optometry clinic, maybe Jennifer, that you could, but I do certainly know that Dr. Cohen has been a huge advocate and trainer for community people, not nationally, internationally. She's a huge advocate for teaching about Alzheimer's disease and is sort of an expert in the field and well known among not just neurologists, but family doctors of the area, and all other community services and supports that work in this area.
So maybe pivoting slightly or turning it over to Shmuel to kind of speak a little bit about some of the challenges and from the Alzheimer's Society of Toronto and launching this type of project.
So I think what we've seen is some hesitation of potential participants to sign up for the study for a number of reasons. One of them being as we discussed before, a lot of people have this notion in their mind that because there isn't a one single treatment plan for dementia or Alzheimer's, there's no reason to have the cognitive assessment. And also another concern that's coming up is just a trust of healthcare. People are concerned that if they do the a cognitive assessment, that may go directly to their doctor or to the ministry or somewhere where they don't want it to go. So in our outreach to community centers, we've been talking about this a lot and explaining the benefits of having early screening for that were the cognitive assessments that we're doing, and also trying to address the concern about the confidentiality and the potential, the concerns about, what could happen if I have this cognitive assessment done.
And do you feel like because it's the Alzheimer's Society of Toronto that is having these conversations with the participants, that it helps establish that trust, and maybe the dialogue is a little bit different than perhaps if it was with a general practitioner or something like that?
Yeah, absolutely. We have already we are already established in the community as supporting caregivers and people living with dementia. So I do feel like that gives us a certain trust for people who are reaching out to, and as well because we're in this more community setting. They don't have to feel like they're going to a memory clinic to get a memory test. We're doing this cognitive assessment in a more community-based setting, sometimes in their own community center that they're familiar with. I think that does provide a lot of reassurance to them.
Absolutely. And this sort of segues really nicely into the follow-up question around, this creates a really unique opportunity, perhaps, for patient advocacy groups to really play more of a role in terms of the care delivery. Would you agree with that?
Yes, I believe so, and I think that there's a really big need for advocacy for government funding for research projects such as these in order to make these assessments and screening more available and more accessible.
And Jennifer, maybe we can pivot over to the optometry world as well, and sort of integrating different care settings in terms of those care pathways. So looking at places like optometry clinics as an avenue for being able to access the dementia diagnosis.
Mm-hmm. Absolutely. So obviously, we have a tool that we use that's a retinal scan. So it does partner well with an optometry center, but at the same time, we were, as Shmuel is saying, we are looking to make this community based. So to bring something towards the participant in places that they are, instead of trying to bring them somewhere else and getting them to agree to somewhere that's maybe far away or whatever, that one center that does something. So instead, the way we view it is that, if you have somebody who's already attending a place on a yearly basis, such as for their optometry visit that they already are used to doing, that's a great opportunity for them also to do something else. So if our scan is very quick and easy and non-invasive and they're already in that setting, so that's something that we could do at the same time that they're already there. That doesn't take much longer, and it can be very informative and something that can be provided to a specialist or their primary care provider to use in treating that patient and keeping the information flowing rather than contributing to a fragmented system.
Absolutely. And, the fragmentation, I think, is probably the biggest thing that projects like these are really trying to fix. Amelia, did you want to jump in on this before we move to the next question? what do you see as the value of being able to kind of leverage some of these non-traditional mechanisms for delivering care? And maybe more specifically, as a nurse practitioner and someone who, really has that close relationship with the patient and follows them along their journey, how do partnerships like these really help you provide better care?
Yeah, that's a great question. So I think the main thing is that we want patients to come and see us to get a really good understanding of their memory concerns as early as possible in the trajectory. So one, if it turns out that their memory concerns are due to a preventable disease, not a treatable disease process or a treatable concern, then we can help to alleviate that pathway or help to treat whatever is going on. If it turns out that their concerns are due to an underlying Alzheimer's pathology, which maybe will hopefully in the future we'll learn through something like the RetiSpec scan, then we might soon have treatment options that we can prescribe for people to help slow the course of the disease. Right now we have only treatments that can provide some symptomatic benefit, but as Jennifer had brought up earlier, we had lecanemab or Leqembi that was recently passed by the FDA in the US, and we're sort of anticipating its arrival here in Canada. So perhaps within a year or so, we'll be able to prescribe a treatment that can slow progression of the disease if somebody is on the Alzheimer's disease trajectory. And the earlier that we can initiate something like that, the better, because that means that's more preserved neural function. That means that people are still cooking and shopping and paying their bills, maybe going to work. Those are all things that if we can assess and properly diagnose as early as possible, and then soon we'll hopefully be able to treat, we can keep people doing well for longer. I think that's the goal for all of us.
Absolutely. And so just before I go to the closing question, is there anything that anybody wants to touch upon that perhaps we haven't touched on yet in the context of this conversation?
One of the things that I've been struck by is that there really is a need for somebody, I hate to say like myself, but like a nurse practitioner or another clinician who can help address the shortage of primary care access and specialist access, somebody who can be trained in this area and can assess people's needs and treat them. I think every piece of the puzzle is so fundamentally important in a study like this. We need the community access points like we have through the Alzheimer's Society and through the optometry offices. We need the technology to make a diagnosis, and then we really need access to people who can take it from there, I suppose.
Absolutely. And, I couldn't agree more. And I think that is what really excites us at the Ontario Brain Institute about this project, is it really is looking at, ways to bring the different partners in care together a little more closely. And, the vision is, if you could have something like even, going back to the idea of a digital human who could do the daily checks or the weekly checks in the person's home, and then it sort of triggers a notification to the care partner or the care team or the nurse practitioner or the GP or whoever that next person is in the line of care, to be able to unpack that a little bit more and understand what the problems that the patient is facing, so that we can intervene before they become even bigger problems. I think this segues really nicely into our last question is, thinking fast forward 10, 15, 20 years from now, what's your hope for the way that seniors interface with the healthcare system and some of the future healthcare, what that future healthcare state could look like? Maybe I'll kick it off with Shmuel.
Sure. So my hope and my vision is that we would have a lot more supports to enable the seniors to be able to age in place and be supported at home, and also to be able to give them a sense of confidence and reliability in our healthcare system, which sometimes is currently depends on different elements in the government or whatnot. So giving them that confidence and that being able to rely on that would then also give more opportunity for the type of screening and assessment that we're doing, whether we're offering it in the community as well as in a clinical setting, which is necessary at some point, as Amelia said, to follow up, to take it for after that point of assessment. So I think really building a stable and robust support for seniors at home, and also for it within a reliability in our healthcare system that doesn't change and doesn't depend on other factors.
From my perspective, unfortunately, I've watched 3 loved ones struggle with what's happening to them as Alzheimer's progresses, and I've been the family member trying to determine what's best to do for them. And so for this reason, having a diagnosis is important for knowing the pathway to take for your loved one and gaining access to available resources. So ultimately, my hope for the future of healthcare for seniors is to create an easy access point for everyone to receive a diagnosis in a timely manner.
This is a very good question. I read recently that this was from some years ago, I think back in 2014, the Public Health Agency of Canada estimated that people living with dementia, specifically men living with dementia, lose about 16 years of life in full health, and women 15.2 years of life in full health due to their dementia diagnosis. And I think that with something like this paired with treatment options that help to slow or hopefully cure the progression of Alzheimer's disease, that we can give people those years back. That's a lot of time that people could have with their families, playing golf and going to the store and going on their cruise to Aruba or whatever it is that people want to be doing with their time. That's what I hope that we can help to give people back good years. And I think one of the major things that we'll have to really focus on is not just treating the disease, but focusing on the disparity that we have in healthcare too. You mentioned, I think, Christa, was it you that mentioned in rural Canada how hard it is to access care? So we see rural settings, we see different communities who are either racially, religiously segregated, really getting care that's different from other people, from Canadians who are maybe wealthier, maybe more well-connected. So I would really like to see us push for providing good quality care across the board.
And so certainly, being able to test out models like this one and others will hopefully help us achieve that future state that is much more equitable and accessible for all Ontarians and Canadians to access the care that they need when they need it and where they need it. And so I think that's a really good place to end on for today. So thank you to our 3 panelists for taking the time to chat with us today. And if there are any questions, comments, concerns, feel free to reach out to any of us and we would be more than happy to follow up. And thanks everyone for paying attention today. Have a great rest of your week.